Types of acne scars: Icepick, rolling, boxcar, and hypertrophic, keloid. In this video, we're exploring a topic that many of us struggle with: acne scars. Not all acne scars are created equal, and understanding the differences can help you choose the most effective treatment options. Over the next 2 minutes, we'll dive into the 4 main types of acne scars: Icepick, rolling, boxcar, and hypertrophic or keloid. Let's break down what each of these scars looks like and discuss how they can be treated. Icepick scars. Icepick scars are deep and narrow, extending into the dermis. They look as if a sharp object, like an ice pick, has punctured the skin. These scars are commonly found on the cheeks and can be quite challenging to treat due to their depth. Treatments often include TCA cross, a method where trichloroacetic acid is used to promote skin regeneration from the inside out. Rolling scars. Rolling scars create an undulating appearance on the skin due to their wide and shallow depth. They result from fibrous bands of tissue that develop between the skin and subcutaneous layer, pulling the epidermis inward. Subcision is one effective treatment for rolling scars, which involves breaking up these fibrous bands to smooth out the skin's surface. Boxcar scars. Boxcar scars are round or oval depressions with steep vertical sides, wider than icepick scars. They give the skin a pitted appearance and can vary in depth. Treatments that can help include laser resurfacing, dermal fillers to raise the depression, and chemical peels to remove the upper layers of the skin, encouraging cell regeneration. Hypertrophic or keloid scars. Hypertrophic and keloid scars are raised scars that stand above the surface of the surrounding skin. They're typically red or purple and feel firm and rubbery. These scars form due to an excessive collagen production during the healing process. Treatment options include steroid injections to reduce inflammation, laser therapy to smooth the scar, and silicone sheets to flatten the scar over time. Understanding the type of acne scar you have is the first step in finding the right treatment plan. Each scar type has its unique challenges, but with advances in skin treatments, there's hope for improvement and even removal. We recommend consulting with a medical professional to discuss which treatment options are best suited for your specific scar type and skin condition. Your self-care journey starts with us. Click the subscribe button for more educational information or book a consultation today.